Hello, my name is Ruxandra Buzoeanu. I'm an MSN student at Liberty University, and today I'm going to perform a Proctored head-to-toe assessment.
And my name is Williams. I'm a nurse practitioner, certified, and I will be evaluating Ruxandra in her head-to-toe exam.
Thank you. I'm going to start my assessment by washing my hands. Excuse me. And the tools I'm going to be using today are, I have a stethoscope, I have an ophthalmoscope, a otoscope, a reflex hammer, some cotton balls, something that I'm going to use to test the smell, a pen light, and a tuning fork, and some cotton balls. I'm going to start the assessment. I'm going to have you ask you to stay on examiner table. I'm going to start with assessing the upper extremities and lower extremities. I'm starting to assess the skin first by observing the skin color, which appears to be normal for race. I don't notice any kind of pallor or cyanosis or erythema or ecchymosis anywhere. Can I take a look at your legs? Good. Now, I'm going to assess the skin for temperature by slightly touching with the back of my palms the skin. It feels warm. All right. Hands feel warm to touch. The skin texture appears to be normal, and the skin, I'm going to test, skin hydration by slightly pinching the skin, and folds go back right to normal. And all right. Now, can you lay down for me? All right. I am going to continue to assess your nails, actually. By looking at the nails, the color looks translucent. Assessing for capillary refill by slightly pressing on the nail beds. The capillary refill is less than 3 seconds. The nails look firm and smooth, and they're strongly attached to the nail beds. Now I'm going to continue with head and face assessment. I'm going to have you ask you to sit up again, and I'm looking at your head. So the head should be in the middle. It should be symmetrical. It's normocephalic. It's rounded. Now I'm going to palpate your skull, if that's all right, by sliding, touching the skull skin. Now I'm looking at the hair. The consistency looks normal. The hair doesn't look too dry or too oily, and it's evenly distributed. Now I'm going to check for paranasal sinuses. I'm going to touch slightly with my thumb inside, in the inner side of the orbit. Tell me if you feel any tenderness or pain.
No.
How about now?
No.
Now I'm going to touch your maxillary bone. Any tenderness or pain?
No.
How about now?
No.
All right, now I'm going to percuss the bones, and you tell me if you feel any tenderness or any pain.
No.
How about now?
No.
How about now?
No.
How about now?
No.
All right. Now I'm going to test your temporomandibular joint. This tests the function, the motor function of the trigeminal nerve. I'm going to palpate over the joint. Do you feel any tenderness?
No.
Any pain?
No.
Now, open and close your mouth several times. All right, does it feel any pain? No?
No.
The joint is moving freely and I don't notice any crepitus or any clicks. The sensory function of the trigeminal nerve, it's, I'm going to text next. Close your eyes. I'm going to touch parts of your face and you just tell me when you feel the touch.
No. 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 No.
Good. The sensory function of the trigeminal nerve looks intact. Now I'm going to test the facial nerve. Look straight at me and then raise and lower your eyebrows for me several times. Good. Now bare your teeth. Now give me a big wide smile. Good. Now puff up your cheeks and then purse your lips for me. Good. All these movements are symmetrical, which means that the function of the facial nerve is normal. All right. Now I'm going to check your the acoustic nerve, cranial nerve too. Can you stand up for me? We will perform the Snell test, which tests the vision at the far side. Can you step back from me as much as you can at the wall? This should be 20 feet. Now look at that chart on the wall and cover one eye and read the lowest numbers or the letters you can.
Line 8, D, E, F, P, O, T, H, Q.
That's fine. This was test. This test was done to test the peripheral vision, the far vision, 20 to 20. The denominator 20, it's the farthest distance a patient could see, and the denominator 20 stands for the distance which a patient can see normally. So the higher the denominator, the poorer the vision will be. Now I'm going to have you sit up. I need my Snell chart. And I'm going to talk about the Rosenbaum test. It's to test the, I'm going to use this, the chart, the Rosenbaum chart, to test the near vision, which it should be at 36, place it at the 36 centimeters from the patient's eye, or 12 inches, and have the patients to read the numbers and the letters, the lowest ones. That's all right, that's it. Now I'm going to check for the extraocular muscle function, which tests the cranial nerve 3, oculomotor, cranial nerve 4, trochlear, and cranial nerve 6, abducens. I'm going to test the 6 cardinal position of gaze. You're looking at me, straight at me, and look at my finger. And then you will move your eyes, keeping your head straight as my fingers goes. Okay, just follow my finger. I'm going to go right up, right far, right lower, left lower, left far, and left up. I'm looking at the eye movements. Eye movements are symmetrically and smooth, so this test is normal. Now I'm going to check the corneal reflex by using a pin light. You just look into a point far behind me and just straight, and try to keep it midline if you can. And I am going to place a light in between your eyes. I'm looking at the reflection of the light in both eyes, and it looks appear symmetrical in both eyes. Now can you, I'm going to test I'm going to do the confrontation test. I will ask you to close one eye, just cover one eye with one hand. While the patient is covering the right eye, I'm covering the left eye with one hand, and I'm going to wiggle the fingers in the 4 cardinal points, and you tell me when you first see the wiggling. This tests the peripheral vision, okay?
Now. 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 Now.
Now cover the other eye.
Now. 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 Now.
All right. You go. This was test the peripheral vision. Now I'm going to perform the ophthalmoscopic exam. Going to grab the ophthalmoscope. All right, the light is not working now. Okay. I'm going to dim those lights. Now look at me. I can see the real reflex. It's broad and uniform. I'm going to come close to your eye, okay? Look at me. Okay. Thank you. What we normally see at the ophthalmoscopic examination is we're looking for the red reflex, which should be red and uniform. Then we can look for the optic disc, and the optic disc should be round and even. As we move closer, we see the physiologic sac, which is like half size of the optic disc. And then we keep continuing, we can see the vessels, the blood vessels, the vein and the artery. Then we can look at the retina, which normally is seen as a bright red orange. And then macula, it's normally free of blood vessels, and retina should be free of exudate. So that was the fundoscopic examination. Now, I want to continue by examining the eyes. Looking at the eyes, both eyes should be symmetrical. The eyebrows should cover partially the eye, and the eyelashes should be turned outward. The eyebrows looking to be, free of scaling. The skin should be free of scaling and eyebrows. Now I'm going to have to ask you to close your eyes while I'm going to palpate your upper lids and lower lids. So I'm palpating the upper lids. I'm looking for any masses or tenderness. Do you feel any pain?
No.
I don't feel any masses or tenderness. Now I'm going to palpate the lower lids. I do not feel any mass or tenderness. Good. Now open your eyes and then look up for me. I'm going to pull down and look at the conjunctiva on both sides. All right, now look down, and I'll pull up the upper lids so I can look at the upper conjunctiva. It looks pink, and sclera, it's white and free of exudates, moist and free of exudates. All right. Now, I'm going to perform to test the acoustic nerve, cranial nerve 8. What I'm going to do, first of all, I'm going to start with examining the ears. So I'm looking at the ears. The ears look symmetrical according with the eyes. I'm palpating. I don't feel any masses or any tenderness. Now I'm going to palpate the mastoid process. Do you feel any pain?
No.
Any tenderness?
No.
Right, no pain and no tenderness. Now I'm going to perform a otoscopic examination. Oh, sorry. That's the only one. All right. Can you turn your hair for me on the other side, please? There you go. I see the tympanic membrane. It's pearly gray. And I see the bony prominences. I'm gonna go on this side. Same in this here. I can see the tympanic membrane. It's pearl gray, and I can notice the bony prominences. Now we continue with performing the Weber and the Raynaud test using a tuning fork. We're going to perform the Weber test, which is the test to perform the conduction that is transmitted, the sound conduction transmitted through the bone. So I'm going to activate a tuning fork and place it on the melodioscope, and you tell me when you not hear the sound anymore, okay? And then you tell me what if you hear it bilaterally on one ear or in both ears, okay?
Yes.
Where do you hear it? Which ear?
That one.
Now we're going to do it again. Tell me if you hear it in both ears, okay?
Yes. Bilaterally.
Bilaterally, thank you. That was the Weber test. Raynaud test is, I'm going to go this way. I'm going to activate the tuning fork and place it on the mastoid process. And you tell me when you don't hear, and I'm going to count. You tell me when you don't hear the sound, okay?
No.
How about now?
No.
All right. Raynaud test is done to measure the air conduction, the sound air conduction versus the bone sound conduction, which normally the air conduction is twice as longer than the bone conduction. This test was normal. Okay. Now we're gonna I still think we're done with the ears. We're going to continue with the assessment of the nose and the mouth. First of all, we're starting by looking at inspection of the nose should be in the midline and symmetrical with the eyes and the mouth. Now I'm going to close one of your nostrils, and then you breathe normally through the other one. So the airflow should be free and easy, and that on the other side. Good. Now I'm gonna look, I'm gonna do an examination looking at the nasal mucosa. I'm gonna slightly pull on your nose. Nasal mucosa look pink. I can see the septum, it's midline, and the turbinates are free of polyps or exudates or inflammation. Now, we're going to examine the mouth. First of all, I'm going to start, by looking at your lips. The lips should be symmetrical according with the face. And now we'll ask you to open your mouth and sting your tongue out. I'm looking at the tongue. The tongue looks pink and it's a little rough. And I am going to ask you to open your mouth. I don't have light anymore. Okay. Big mouth, big mouth. Now sting your tongue out and say ah.
Aww.
Keep saying ah.
Aww.
All right,
Aww.
good. I'm examining the hard palate. It looks gray and rough. And then I'm looking at the soft palate. Relax, relax. The soft palate looks muscular and pink. Now, can you open your mouth and then put your tongue up? I'm looking underneath your tongue. I can see the blood vessels and I can see the salivary ducts. All right. Now I'm going to check the hypoglossal nerve function, nerve number 12, by placing the tongue blade inside your mouth, and I'm going to slightly push against your tongue, and then as you feel resistance, try to resist me pushing you, okay? So pull back, good. Pull back, great. Now, the function of the cranial nerve, vagus nerve, is check the swallowing, the gag reflex, and the speech. Can you tell me how old are you?
19.
Okay, so the speech looks clear, and can you swallow for me? All right, so gag reflex is present, so the nerve function is intact. So that was the mouth assessment. Now we're moving to do the neck assessment. First of all, we started with observing the neck. The neck should be erect and should hold the head up. I'm looking at the muscles. The muscles look all right. The skin looks normal. I do not notice any kind of masses or nevi or anything abnormal on the skin. Now I'm going to check the motor function of the spinal nerve, accessory nerve, by testing the strength of the shoulders. I will ask you to, shrug your shoulders up, pull up against my hands. Don't let me pull down. Good. So that's the, I can test the function of the muscle. It's the trapeze muscles. It's symmetrical. And Now I'm going to check the strength of the muscles in the neck, the range of motion in the neck. So can you bend your head forward for me? Try to reach your chest with your chin. Now go back up. Now try to move your head to the right and to the left. Nice and easy. Good. Now try to reach your shoulder with your ears on both sides. Good. And now try to pull your head back as much as you can. So that test is for hyperextension of the neck, which all look normal and intact. Now I'm going to test, I'm going to put some resistance over your chin while I'm trying to push your head on my side to try to push back. Good. Good. Now try to push down against my hand. Okay. Now push back. Good. So the strength muscle, it's normal. Now I'm going to continue by palpating the lymph nodes at the neck. My hands, I feel a little cold. I'm going to warm up my hands a little bit. I'm going to start by palpating the periauricular lymph nodes with smooth and nice rotating motions. Do you feel any tenderness?
No.
Any pain?
No.
Now post-auricular. Any pain, any tenderness?
No.
Occipital lymph nodes. Any tenderness?
No.
Tonsillar.
No.
Submandibular.
No.
Submental.
No.
Superficial cervical.
No.
Deeper cervical.
No.
And supraclavicular.
No.
All right. So that tests the lymph nodes. Now I'm going to test inspect and palpate the trachea by locating the sternal notch. I'm going to move trachea left to right. All right, it moves freely. I'm going to test the thyroid gland. There are like two ways to test the thyroid gland. From the anterior side, in which I can place my fingers on the left side and push on the right side and push to the left, and then I can palpate it in here. Have the patient to extend your head and swallow. I can feel it here freely moving. Or from the back, if you could stand up for me. Okay, I'm going to sit behind you. And I'm going to palpate it, and then you will extend your head, push your head back, and then swallow. Good. All right. You can go sit back. And now I'm going to check for carotid pulse by pressing slightly on the carotid arteries. I notice pulses are regular and strong. All right. Now we're going to move to the chest. Inspecting the first part of the assessment of the chest is inspection. So first of all, I'm inspecting on the skin anteriorly and posteriorly. I'm looking for the color. I'm looking to see if there are any abnormal lumps or masses. And look at the anterior, posterior, and transverse diameter by looking around the patient. The anterior posterior diameter, should be always larger than the transverse diameter. After we're done, then I'm assessing, the breathing pattern just by simply watching the patient and counting the breathing. All right. Respirations are regular and unlabored, and anywhere between 12 and 16 respirations per minute. Now I'm going to continue the assessment by palpating the chest. I am looking like anteriorly, I'm palpating the scapular bones. I'm palpating the sternum, palpating the rib cages, and then notice for any abnormal deviations. Looking at the back, I'm palpating the spinal cords or placing my fingers on the spinal processes. You can bend forward if you can. And they look normal. The scapular, inferior scapular angles, they all look normal. Now I'm going to continue with percussion of the chest. I'm going to start percussion in the right upper side. I move down. Oh, sorry. Percussion should be done in between the intercostal space. Now I'm going to ask you, I'm going to place my palms on your chest, and you're going to repeatedly say 99 as I'm checking for tactile fremitus. All right, go ahead.
99, 99, 99, 99, 99.
Good. Same percussion from the back. Stabilize to high. I'm going to start in a supraclavicular area. Over the chest area, when you percuss the lungs, you should hear hyperresonance sounds. I'm going to continue with testing the chest excursions. So I'm going to place 2 fingers right here in the middle, right below the xiphoid process, and hold the rib cages with my hands, with my fingers, and I'm going to ask you to take some deep breaths. As you notice, my fingers separate, and you can notice the movement of my fingers as the patient breathes. The same is in the back when testing from the back. Can you stand up, please? All right, and turn back to the camera. Turn back to the camera. There you go. And take some deep breaths. So you can notice chest excursions. Good. Good. Now, as you stand up, I'm going to listen to your lungs. Take some deep breaths for me. Good. Now turn around, and I'm going to listen to you. So you can see it. You can see it. And I'm going to listen from the front. Good. Over the trachea, normally we hear a bronchial sounds. As we move down to the chest, we hear bronchivesicular sounds. As on the lateral lower sides, we can hear the vesicular sounds. The lung sounds clear, which means that the air is moving into the chest. I'm going to use some hand sanitizer. I'm gonna move to the heart. Assessing the cardiovascular system, again, first we started by, assessing the skin and looking for any change in color, if there are any masses, any changes from normal. Then I'm going to have you lay down. And I'm going to feel for the point of maximum impulse, which is 5 intercostal space on the subclavicular line. I can feel it, it's regular. Good. Now I'm going to listen to your heart. You can listen to the heart in a supine position or a sitting position. So I'm going to start. You can lay down, yeah, or you can sit up. It doesn't matter. All right. Listening to the heart sounds, we're going to start with the second intercostal space on the right side of the sternum, which is the aortic sound. We'll continue with the left second intercostal space, which is the pulmonic sound. Third intercostal space would be our point. Fourth intercostal space would be the tricuspid valve sound. And on fifth intercostal space, mid-clavicular line, will be the apex, which is the mitral sound. All right, great. You can sit up. All sounds are regular. I don't hear any murmurs or any clicks. They're regular, they're strong. Now I'm going to check the carotid pulses. And I'm going to correlate actually the carotid pulses with the heart sounds by placing the stethoscope on the apex and the fingers on the carotid artery. Okay. They both correlate. Now I'm looking to check peripheral pulses. Radial pulse, brachial pulse, carotid pulse I just checked. Now this is popliteal pulse. Dorsalis pedis and posterior tibial. All pulses are strong and regular. Now I'm looking to notice if there is any edema. I'm holding my fingers for about 5 seconds and I don't notice any edema. Good. 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 So that was the cardiovascular assessment. Now you can lay down. You may lay down, and we're going to continue with assessing the abdomen. First part of the abdominal assessment is, of course, checking and inspecting the skin. So I'm looking at the skin. I'm trying to notice if there are any abnormal masses or any abnormal texture in the skin. After we finished inspection of the abdomen, we were going to auscultate next. Always auscultate the abdomen before palpating or percussing, since might cause hyperresonant vowel sounds. Always auscultate in all 4 quadrants and try to auscultate for at least 2 minutes in each quadrant. Our vowel sounds present in each quadrant. Now we'll continue to listening to the blood vessels. Normally use a stethoscope that has a bell. I'm going to apply very light pressure with the stethoscope, which it will make me hear the sounds as like I hear it with a bell. So first of all, I'm going to auscultate for aortic artery, renal arteries, iliac arteries, and femoral arteries. Now, the next step of the abdominal assessment is percussion. I'm going to start with the right upper quadrant and then percuss at each quadrant as I go through. Normally when we percuss, when we reach over the organs, normal sounds are dullness and resonance over the air spaces. Now I'm going to locate the liver by percussing, and I'm going to start percussing, starting with the chest and then going down on the right upper quadrant. See, at this point, I don't hear resonance anymore. I just hear dullness, which this is the superior margin of the liver. At this point, I should mark that with a pen, and then I'm percussing from down up, and again, I'm going to hear resonance, and then when I hear dullness, I will stop. There, I will stop here. So I'll mark both sides, and this is the inferior margin of the liver. This is how the liver is tested on percussion. Now, I am going to palpate the liver by placing one hand in the patient's back and then palpate and placing my fingers underneath the rib cage while the patient is taking a deep breath. Take a deep breath. Good. Now I'm trying to palpate the spleen by going with my hand on the other side, and again I'm placing my fingers underneath the rib cage. Try to take a deep breath. Okay. Now palpating the kidneys. When palpate the kidneys, we go from the back. My hand should be in the back. The other hand, I'm going to put pressure on it and bring my hands together where I'm trying to palpate. I don't palpate anything. All right. So, I think that's it. You can sit up for me now. We're going to move to musculoskeletal assessment. We already assessed the range of motion and the strength of the neck earlier. And we're going to move to the shoulders. To assess the strength, again, I'm going to ask patient to place your arms like this, and I'm going to push you down. You don't pull up against resistance. Good. And now don't let me pull you up. Push back. Good. It's a good strength. Now test the range of motion. And then we can do that from the, well, with a shoulder extended and rotated, flexed and rotated. So hold your arms like this. I'm going to try to push you down. Don't let me push down. Pull up. Good. Push down. Good. So strength is good. Now we're going to test the range of motion by having the patient to flex your arm and hyperextend all the way over your head. All the way over your head. Good. Do the other one. Good. Now I'm asking you to test abduction and adduction. You know, ask the patient to, you know, move your arms away from your body and move your arms back. Go all the way up and all the way down. Good. That tests abduction and adduction. Now to test internal and external rotation, I'll have the patient to hold the arm flexed like 90 degrees, and I'm going to have you to pull your arm, just rotate your arm inside and outside. Good. And go back. Now to check the strength, I'm going to have you ask, you know, push resistance against my hand. Good. Now pull back. Good. We're doing the same with this arm. Okay. Now bring your arm down, rotate it in, rotate it, external rotation. And again, push against my hand, pull against my hand. Good. Now we're going to test the strength and the range of motion of elbow by having the patient to flex and extend your forearm. Just go up, up and down, up and down. Now the strength, now try to push against me. Good, don't let me pull back. Good. Now, testing the hands, we're gonna first test the supination and the pronation. So show me your palms, that's supination, and then put your palms down, good. Now I'm gonna test the strength, push against my hands, push down, good. Now, I'm going to try to push you and push me back. Push me back. Good. Now, place your fingers like this and then bring them back. Again, bring them back. Now, I'm going to try to pull them together. Don't let me do that. Good. Good. And now make a fist. Good. Now grab these fingers and then squeeze them well. Good. Good strength. Now we going to move to test the hip. Would you lay down, please? First of all, we're going to test the this table is too small. I'm going to ask you to, you know, pull your leg up, straight and up, as much as you can. Go. Now go inside that area. Okay, now come to me. Good. Now I'm trying to push it down. Don't let me push down. Good. Now push against me. Don't let me pull up. Good. Let's do the same with the other leg. Up as much as you can. Now bring it toward me, not toward the wall. Toward the wall. Good. Now push up, and now push down. Good. Good. Gonna do the knee. Okay, we're going to test the internal and external rotation of the hip. I'm going to bend your knee. I'm going to bend your knee. Bend your knee. All right, and I'm going to bring your leg that way, this way. All right, pull down. And the same with this one. This way and that way. All right. Good. Now I'm going to ask you to bring your knee to your chest. Bring your knee to the chest, all your way to the chest. Good. And the other one. Good. Good. I'm going to ask you to sit up now. We're going to test the knee. Range of motion in the knee, it's pretty limited. Normally, it only has, you know, flexion from extension. It's up to probably 90 degrees. Can you flex your foot? Can you bring your foot up toward me? Good. Push up. Don't let me pull you down. Good. And then this one too. Flexion. And then strength. Okay. Okay, good. And now I'm going to test the range of motion on your feet. I'm going to take these off. Is that okay?
Yes.
Now, can you move your ankles up and down? Supination and pronation. Now, I'm going to place my palms underneath your feet and then push against my hands. Don't let me pull back. And now, pull toward your nose. Pull toward your nose. Put your fingers to your nose. Don't let me push it down. Good. And then, if you can stand up for me, we're going to check the spinal cord. You can put your feet. Your feet are cold. Now turn back. Turn back. Turn your back to me. So I'm checking for the spinal cord alignment. I'm looking to see if the spinal cord is symmetrical. I'm looking to see any kind of deviation, like scoliosis or kyphosis, any lateral deviations or anteroposterior deviations. Now I'm going to ask you to bend over. Can you come a few steps toward me? Come a few steps toward me and bend over as much as you can. See, this test is testing the flexion of the spinal cord, and now come back. I'm checking the spinal processes. They all look normal. And can you try to pull back as much as you can? There you go. Perfect. So I don't notice any deviations, anterior, posterior, or lateral. So spinal cord is aligned normally. The shoulders and the iliac crest, they look symmetrical at the same position. All right. Good. We going to test reflexes now. Would you sit up for me, please? I'm going to start by testing the bicipital reflex. I'm going to place my thumb on the biceps tendon, and I'm going to tap over my thumb. This causes flexion of the forearm. Perfect. Now I'm going to test the reflex on the triceps muscle, and I'm going to tap over the triceps muscle tendon. This should cause the extension of the forearm. Good. Now we're going to do the brachioradialis reflex by locating the styloid process of the radius, and then we're going to tap like a few centimeters on above, and that this should cause the movement of the hand. Good. Now we're going to test the patellar reflex. I'm going to place my hand on a quadriceps muscle and tap on the patellar tendon. Oh, come on. Doesn't want to get it now. No. There you go. That should cause the extension of the leg as the quadriceps muscle flexes. And the last reflex we're going to test is the Achillean. As I'm tapping on the Achilles tendon, the foot should dorsiflex. There you go. Good. Now we were going to perform a very brief neurologic examination since we already performed the cranial nerve examination. But I'm just going to ask, I'm going to start by asking the patient your name.
Selena,
Okay, and how old are you?
7.
Okay. Do you have a favorite? Are you in college?
Yes.
Okay. Do you have a favorite movie that you normally watch?
Pretty Woman,
Okay. Do you know who's the President of the United States?
President Barack Obama.
All right. So I'm just checking, you know, the orientation to time, space, situation, and person, place, time, and situation. There is one thing that I omitted in my eye examination, the pupils. I'm going to check the pupils. No, okay. All right, I'm going to have you look at me, and I'm going to bring a light from the periphery to the center. Okay, this causes actually contraction of both pupils, although the light goes on one eye. Here the same. So the reflex is normal. This means that perla means that the pupils are equal, are rounded, are reactive, and they accommodate to light very well. And I've also omitted to check of cranial nerve 1, which tests for smell. So I'm just going to use a smell, and I'm going to have the patient to close eyes and tell me, what do you smell?
Smells like perfume.
Okay. Normally we cover one nostril and trying to perform different smells on both nostrils. Got that. And the last thing of the neurologic exam is the cerebral function testing. I'm going to ask you to sit up for me. Stand up. And then, can you walk a few steps? And then can you come back to me? As the patient walks, we normally observe for gait, any abnormalities, any deviations from the gait pattern. It looks normal. And then I'm going to perform the toe to heel walking. So I will ask you to walk toe to heel like this. Do a few steps. And observe the gait, any deviations from abnormal, which is normal. You're good. Great. The last test, I'm going to test, you know, the gait with the eyes closed. So as you close your eyes, I'm going to have you, you know, stand up with your eyes closed for at least 20 seconds. In these 20 seconds, while the patient's sitting up with the eyes closed, we watch for any kind of deviation from the gait. You're okay? Now you can open your eyes. All right. And now, to test for the cerebral function as well, let's just sit in here so we can both sit in front of each other. And then you're going to look at my finger. I want you to look at my finger, touch my finger, and touch your nose at the same time. Let's do it several times. Do it faster, faster, faster. Great. Now do the same thing with the other one. Great. Now I want you to close your eyes and again touch your nose with your finger. Do it several times. Perfect. Great. And now you can sit up. Sit up from me, and I'm going to check for stereognosis. I want you to close your eyes. I'm going to place an object into your hand, and you will make a fist and feel the object, and you tell me what it is with your eyes closed.
It's a quarter.
Okay, good. Open your eyes. And the graphobia test. I'm going to use this, and I'm going to draw a number in your palm while your eyes are closed, and you tell me what's the number. Okay? Open your palm.
3.
Great. I'm going to do the same thing on the other arm.
6.
Good. All right. I think that's... And I'm going to assess the touch pain. I'm going to assess, the sense of touch and pain. I'm going to have you to close your eyes, and I'm going to touch you in several parts of your body, and you tell me, when do you feel the touch? You can tell me now, okay?
Now. 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 Now.
Good.
Now. 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 Now.
All right. And the last thing I'm going to check is pain. I'm just going to use this blunt metallic piece. It's not going to hurt you. You just tell me when you feel it, okay? Close your eyes.
Now. 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 Now.
Good. I think that's all. Thank you for watching this video.